with the group. So we'll welcome you and tell us what you're going to be talking about.
Sure. Hi, I'm Susan Colen. I'm the program director for breastcancertrials.org, and I will just do a very sort of high level overview about clinical trials and then talk about how to find them using our tools. So thank you for having me.
That's wonderful. And Susan, you're gonna run your own PowerPoint, right?
Yeah,
that'd be great.
Sorry, yes, I tried to send them last night, but the file was too big. So I've done this before, so I think it should be fine.
Yeah. So Brett, why don't we, just get Susan uploaded here. I mean, get her to make sure the screen and all that's working, because she's going to be our first speaker.
Are we ready? Shall I start?
Yeah, let's get it up on the screen, make sure everything's working technically, and then we'll start here in about 5 minutes. But you want to try that, Brett? Make sure she has any troubles. So, oh, you're good. Look how fast you are. Excellent.
Let's see.
No issues.
It should be no issues. So let's try this.
Perfect. That looks good, but because I don't want anybody to miss your talk, because we've got you scheduled here at 10.
Okay.
But let's just leave your screen on up and everything. But anybody else has anything they want to share quickly before we get started? We're open to discussion right now. You see any? There we go. See here. Let's real quick get the screen there. All right, there we go. All right, just for the upcoming, for the month of November, we don't normally have our men's only and our fourth Thursday, but due to the holidays, we are not going to have that, and now just having our conference. And the same for the December holidays that are coming up. We want everybody to be able to spend this wonderful time of the year with their families. So unless you need us for something, we're available at any time, 24/7. You've got my cell number and Brett's available. We're both available for anything anybody wants. And I've put my email into the chat box for anybody to, contact myself at any given time. We're there for you. We have many specialists that do the same. If you need help for anything, just contact us and we will connect you all with that. And as I said, we've got the shirts coming in. I actually pick up by tomorrow, and anybody wanting shirts, this is what we give to our men free of charge, but our entire Male Breast Cancer Happens family, because we want to get the message out. And what a better way to get the message out than wearing our shirts. People stop me when we go shopping and stuff and want to know more about it. And usually if I'm talking to a man, they'll immediately start checking their breast right in front of me, because they didn't know. They didn't know they should be getting checked. And that's the message that we need to do globally to get that message out, that, let men know. Men have breasts too. So we're just excited to continue to spread our message. This is our 6th annual conference. The last 3 years have all been virtual. The ones that we got together starting in 2017 were amazing, to be able to actually meet all the different men. And I hope someday soon that we'll all get to do that again and be in person. And when we do that, we are going to bring it here to the Kansas City area, heart of America, to make all this happen. So again, we're just excited to be here. Any questions that you might have, and anyone speaking, we would love to send a shirt to you also. Just in an email, shoot to me, your sizes you need. We'd love your whole families to be wearing them, and address on where to ship those to. We will be getting them out. So, Brett, just have another little go at saying something to everybody. And can you unmute there? Are you there?
I'm here, but
I'm gonna mute.
yeah, as we near towards time, look forward to hearing from all of our speakers today. And like my mom said, hopefully we can get an in-person back together here in the as she said, heart of America, but barbecue capital of the world here in Kansas City. Some of the best damn barbecue you'll ever have. No. But hopefully, yeah, we can actually meet a lot of these people that are going to speak today in person that we have never done before. So I would definitely appreciate doing that. So and then everybody can see all my kiddos.
Yeah.
So
He's got 2 of them now.
yep. Ryder is 7 months and Riley's 3 years old. Both are getting through the whatever's going around right now, the coughing, mucus, and all that fun stuff. So the joys they never really tell you about kids. So
Excellent. So, I think we're close to our time here. Without further ado, Susan, let's let you get started.
Okay, thank you. Well, like your kids, Brett, I'm just getting over the cold situation, and I had a sore throat for days, but I feel a lot better today. So bear with me if I'm taking some water during talking, because yeah. Okay, well, thanks again for having me here, and for this opportunity to talk about clinical trials, and especially how to find them. Breastcancertrials.org is a nonprofit program of a larger nonprofit called Quantum Leap Healthcare Collaborative. We provide a free trial matching service that's designed specifically for patients. And I've been involved with this work since 2009, just after breastcancertrials.org launched as a nationwide service. And I've had the honor and the pleasure of working with our team and with the broader advocacy community to help grow and improve our products and services. And I'm going to first give just a very general overview on clinical trials, and then we'll talk more about how to use our tools to find them. Okay, so clinical trials are research studies that evaluate new approaches of cancer care in people. And, clinical trials are only conducted in people after preclinical studies, which are the lab and the animal studies, have shown promising results. They're done in 3 phases. The phase 1 trials test to see if a new treatment is safe and how it works in the body. Phase 2 trials look at to see if the drug is effective, and also looks at potential side effects. And phase 3 studies look at whether or not the new treatment is better than the existing standard of care treatment. Okay. So a common myth is that trials are only used as a last resort for people who have run out of options. But clinical trials can be considered as a treatment option at any treatment decision point for anyone affected by breast cancer, including people with DCIS, early stage or metastatic breast cancer. There's also trials for post-treatment survivors and people who've completed treatment for early stage breast cancer, as well as for people who haven't had breast cancer. And those trials look specifically at better ways to screen for breast cancer or ways to prevent breast cancer. And there are many different types of trials. I think, when people think of clinical trials, they typically think of treatment trials, which study new drugs or therapies like vaccines or immunotherapies or targeted therapies, or ways to improve procedures like surgery and radiation. But there's also non-treatment trials, which include studies that look at managing side effects, such as, chemo brain, nausea, or fatigue. And many treatment trials incorporate diet and exercise and other modalities like yoga and acupuncture to manage side effects and symptoms, and also to prevent breast cancer recurrence. Registries are another type of study and are a great way for anybody to participate in research. They typically involve questionnaires or surveys and sometimes include blood or saliva samples. But the data collected through these registries are used to inform future research directions, which ultimately contribute to improved treatment and improved care. And there's registries for anyone, including people with breast cancer as well as for people without breast cancer. So this is a type of research that anyone can participate in, often from the comfort of your own home, and it's an easy way to contribute to improving cancer care. It's important to remember that trials are research and the outcomes of trials are uncertain. So a study, drug, or procedure or strategy can be better than the standard of care, or it might not be, or it could work better in some people, but not for all people. And it's also important to know that treatment is never withheld in a cancer clinical trial. Participants will always receive either the study drug and or the standard of care treatment you would receive if you did not participate in the trial. You will never receive only a placebo in a cancer clinical trial. The benefits of participating in trial is the potential to get access to promising new drugs at the forefront of cancer treatment before they become available to the public. And while in a trial, you also receive additional monitoring and care from the clinical trial team, and you have the opportunity to help others with breast cancer in the future. So what's the problem? The problem is that less than 10% of adult cancer patients participate in trials. And as a result, up to 75% of trials end up having to shut down for low recruitment, which slows down the process of developing new drugs and treatment options. And we also know that there's a lack of diversity in clinical trial recruitment and enrollment, which affects the ability for researchers to study how drugs work in different and diverse patient populations. For example, do drugs work differently in men versus in women? So there's many reasons for the lack of patient participation, but one known barrier is that patients simply don't know that clinical trials are an option for them. And even if they do know, they're very hard to find. So this is why breastcancertrials.org was created. BCT, breastcancertrials.org, or BCT, came about as an idea from two patients who had breast cancer in the late 1990s. And they were interested in clinical trials, but their doctors either didn't tell them about trials or only knew about the trials at their own hospital or institution. So they each attempted to look for trials on their own and found it very challenging. After they completed their treatment, they both they joined forces and came to the University of California at San Francisco with the idea of developing a patient-facing website to make it easier for patients to find trials on their own. BCT was developed and incubated at UCSF at the Breast Care Center here. And after 10 years of research and development, in 2008, it was launched to the public as a nonprofit nationwide free trial matching service. And the mission then, and still is to empower all people affected by breast cancer to consider clinical trials as a routine option for care at any point in their breast cancer care. So how do people find trials today? Typically, they use clinicaltrials.gov, which is the government website that lists all trials that are open and active in the US. And this website was not designed for patients. It actually consists of trial information uploaded by sponsors and researchers, usually taken directly from a study protocol. And as a result, it's not easily understood or used by patients. And the search feature on clinicaltrials.gov is very limited. It's confusing and it's hard to navigate, even for providers looking for trials for their patients. Breastcancertrials.org was specifically designed to make it easier to find trials and understand clinical trials. We list all the clinical trials that are open and recruiting in the US, and our trial information comes directly from clinicaltrials.gov. But we then rewrite the information in plain language summaries, including the trial title, the purpose, a high-level description of the eligibility criteria, and what's involved if you were to enroll. We also include related information from outside sources that could be helpful in understanding more about the content of the trial. And then we code the eligibility criteria, the relevant inclusion and exclusion criteria, so that trials can be matched to a patient's specific breast cancer profile. And we're continuously improving based on feedback we get from patients, providers, advocates, and other breast cancer organizations. And lastly, we're a nonprofit organization, which means that we don't sell or share patient data for any reason, and we don't promote or highlight any one trial over another. And that way we can stay true to our mission to educate patients in an unbiased way about all of their clinical trial options at any point in their care. There are 3 ways to find trials using our tools. Breastcancertrials.org is for people with DCIS or early stage breast cancer and for post-treatment survivors. And you can use breastcancertrials.org browse feature to see all of the trial listings and then use the search, sort, and filter options to narrow the results. Or you can use BCT Match, which requires filling out a questionnaire about your breast cancer diagnosis and treatment history. And then you receive a personalized list of trials that match to your specific situation. In 2015, we developed Metastatic Trial Search, and this was in response to feedback that we heard from the metastatic breast cancer community. They wanted a tool that addressed the specific and unique needs of people with metastatic disease. So we collaborated with 5 other advocacy groups and developed Metastatic Trial Search. and designed it as a standalone app that can be embedded on their websites. And currently, Metastatic Trial Search can be found on over 30 advocacy websites, including Male Breast Cancer Happens. So now I thought I would do a quick demo of how to use Metastatic Trial Search to find trials. Okay, can you see my screen? The breastcancertrials.org screen? By any chance?
Yes, we can.
Yes, okay, good.
Okay.
Okay, so you can find breastcancertrials.org on Metastatic Trial Search on breastcancertrials.org. And like I said, you can find it on over 30 other sites as well. And you can use this tool, MTS for short, as a guest, or you can create a profile by registering and returning to the site and logging in. And we find that most people use MTS as a guest, and they start this way just to see what to expect, and then they go ahead and create a profile, which you can do at any time. Because you can then save your information and return to look at new trials as often as you want without having to re-input your information. So as a guest, we ask, I think it's 6 questions about your diagnosis and demographics. And you can answer as many questions or as few questions as you want, and you can skip to trials at any point. So for the purpose of this demo, let's say that the patient has hormone receptor positive, HER2 negative breast cancer. And if you know the status of these other biomarkers, you can select them, or you can, the default is unsure. So we'll leave that for now. And if you have a specific subtype, you can enter that here, or you can skip the question. And then for this question, we ask about current sites of metastases. And the questions that we ask are important and impactful in determining eligibility for clinical trials. So we ask this question so that we can filter the trials, and you don't have to navigate through trials that would not be relevant for you. So in this case, let's say there's liver metastases, and then we can enter the date of our diagnosis. And here you can select the your biological sex. So I will select male here. And we do code the trials based on eligibility for gender. And what we have found over the years, in a very good way, that there's many more trials that do not exclude men. It used to be that the majority of trials were for women only, but there has been guidance recently, I think in 2020, that I'm not sure if it's required, but I know it's recommended that trials do not exclude men and include both men and women, unless there's a very specific reason not to. So, but in this case, there are some trials that do exclude men, and instead, again, of having to navigate through those trials and ultimately find out they're not enrolling men, we do code and filter trials that way. And here, again, questions are optional, but it is important to enter your zip code, because that is how the trials by default they're listed in order of distance from your zip code. So these are the questions that we ask when you use as a guest. If you do eventually choose to log in, or register and create an account. The full profile, which you can access here, asks questions about your treatment history, because trials are very different depending on whether or not, if you're newly diagnosed versus having 1 or 2 or many lines of therapy. Trials will be very different according to that status. So we do encourage people to fill out the full profile, and that way you can save your information and not have to re-enter it when you return. And you also get access to certain features, having an account versus using the tool as a guest. So you can see here, we entered a profile as a male, hormone receptor positive, HER2 negative with liver metastases. And we went from, I think there was 420 trials to 194, which is still a lot of trials to navigate. So we provide ways to filter, sort, and search these trials. You can sort of right away limit the distance and say, I want to see only trials that are 100 or even 50 miles from my zip code, or I want to look only at treatment trials at this time. But and by doing that, say we selected 100 miles from our zip code, we will be filtered down to 29 trials that are near us. But there's other ways to filter trials and to look at trials that are open across the US. For example, if you knew you were interested in a specific type of trial, and we have people that call us all the time asking if there's immunotherapy trials for them, you can select the filter by trial type and select any specific type of trial or as many. But if you were interested in vaccines and immunotherapy, you can look specifically for those and identify the trials across the US in case there were options, closer to family or where you could potentially travel to and participate in those trials. So we still have 54 trials. That's a lot. We can again look at immunotherapy trials 100 miles from our zip code. So I'll filter that way. You can also filter by mutation. So if you have had a genomic profile of your tumor, and have those results, you can select one of any or several of these genomic mutations and look for trials that are targeting those specific mutations. So, like I said, we take the information from clinicaltrials.gov and we rewrite, not only the purpose in a very high level sentence. We also rewrite the titles, and we do provide the scientific titles, but as you can see, they are more complicated and can be a barrier to patients who want to browse through trials and can't really understand the trials. So we do rewrite the trials titles, but we provide the scientific titles for people or providers who are using the site and can actually access a lot of information from them. So we can turn that feature on or off. And we also provide a high-level overview of the eligibility criteria, and also have a link to the information on the clinicaltrials.gov site that lists all the eligibility criteria that will ultimately determine eligibility. But again, our matching and filtering is a screening, so to speak, for trials that fit your profile. And we don't want to, show you trials that you would not be eligible for and require people to navigate through 100, 200, or 300 trials that are not relevant to your situation. So we also provide a very high level description of what would be involved if you participate, more information about what's being studied, and links to some external sites that would help get more information about the type of drug or procedure that's being used in the trial. So what happens if you're interested in a trial? You can save it as a favorite, which you can do if you have an account and you're logged in, or you can print the trial information, and we always recommend that you share this information with your doctor. You can print it and take it with you to your doctor appointment, or you can share via an email. It would pop up and include a link to this trial, and you can send to your doctor. You can share the information with family members as well, or you can contact the research site directly, and we provide information about all the sites where that study is being conducted, and phone and email contact information as provided or as available. So I do have one more slide, but I'm going to stop here and see if anybody has any questions on using the tool to find trials. So, and we're also available for questions. If you are using the tool and you need help filling out the form or navigating the trial results, you can always call us or email us, and we have a helpline that can help walk you through the process. So my last slide is just to let you know that we also produce a monthly publication to help people stay informed on what's new in metastatic breast cancer research and clinical trials. And each month we select 5 topics, and we work with a medical editor to select patient-friendly, unbiased, and useful content related to that topic from trusted online sources. And we have over 100 topics in categories such as research news, from the experts, where we have a specific topic on male breast cancer treatment and clinical trials, and other categories like inside clinical trials, which has topics that explain or go into more detail about common clinical trial terms and processes, and a category of resources and support. We also list all of the new trials that have been added to Metastatic Trial Search within the past month. And this information also helps to put clinical trials in context, so people can understand more about why trials are important for themselves, as well as for moving the needle in advancing breast cancer care. So I have 2 other things I just want to say. One is that we're working on developing an app for early stage breast cancer in the same format as Metastatic Trial Search that will be available to be embedded or included on our partner websites as well. We'll also have a publication for early stage trial breast cancer patients similar to Metastatic Trial Talk. And the last thing is that we are about to launch a new version of Metastatic Trial Search. So I wanted to just let you know that if you go to Metastatic Trial Search after our launch date is now December 1st. So if you go in December and ongoing, it will have a different, well, I will show you a different homepage that will look like this. And it is a fully mobile responsive site, which means you can use it on your phone or your tablet in any setting. And we've taken the opportunity to make some improvements on the user interface. So using the searches, the filters, and the sort options will be made more consolidated and a little easier to use. So that's all I have today, and I thank you for your attention, and I'm open to any questions now or at any time. And I wanted to put up the links to all of our tools, and as well as my email address. And I thought I had my phone number here, but our phone number and email, help desk email, can be found on all of these sites.
Okay, and you might want to put it in chat, Susan. This is wonderful information.
I will.
Yeah, shoot it right down there on chat so anybody needs to connect. But applaud you. This is knowledge is power, as they say. And anyone have questions for Susan right now that they can think of off the top of their heads? Or again, we're going to be having all these talks will actually be on our YouTube channel for anyone to view over the next, forever. They'll be there. And this is just great information.
Great.
But we thank you for all of it, and get that there.
Okay, so I'm entering, I'm trying to multitask here.
Sure, go ahead for it.
My phone number and contact information. Well, I'll put the phone number here. So for anybody who
That'd be
wants
perfect.
to
Oh,
call.
we
Yeah.
got it there. That's
So
excellent.
it's in the chat. Thank you again. I really appreciate this opportunity.
Oh, we can't thank you enough.
And have a wonderful conference.
Thank you again, Susan. Appreciate it.
Thanks.